Dear students, welcome back. Now we are going to see the characteristic features of a typical vertebrae. So a typical vertebrae has two parts. One is the body. So this is the body on the anterior aspect, and another, this is called arch on the posterior aspect. This is the arch on the posterior aspect. So, and in between the body and arch, you'll have a foramen called as vertebral foramen or vertebral canal. So all these foramens combine to form a canal which helps transmits passage of spinal cord with its meninges and blood vessels through this foramen. Okay, and now we will see how the body, what is the shape of the body and what are its surfaces. Okay, so before starting that individual thing, first you should know the parts of the typical vertebrae. So this is the body. So anterior side it is the body, and posterior side it forms an arch, isn't it? So now we will see one by one. This is the body, and arch is formed by the pedicles. So here a small connection. So this is called pedicle, and the pedicles on both sides run somewhat laterally and then posteriorly and medially, so to form, and it is going to join like this, forming a lamina. So this part is called as lamina. The joining of two pedicles forms the lamina, and then it extends posteriorly. After joining, it is going to extend a single processes called spinous processes. Okay, and also before joining with the lamina, it is giving another process on the lateral side. This is called as transverse processes. What is called transverse processes. And also at the junction of transverse process and the pedicle, superiorly an articulating facet is present. So this will articulate with the another vertebrae. So this is called as facet of superior articular process. Superior articular process. So the same articular process is also present on the inferior aspect. This is the superior aspect. So inferiorly also we are having a pair of facets at the inferior aspect, that is called as inferior articular processes. Inferior articular processes or inferior articular facets we can call it as. So these forms the facet joints. Now tell me what are the parts. So anteriorly it is having body, and posteriorly it is having vertebral arch. So how this vertebral arch is formed? So posteriorly it is having an extension of bone that is called pedicles. So the two pedicles run posterior-medially forming laminae, and it is extending still more backwards to form a spinous processes. At the junction of this pedicle and the formation of lamina, it gives laterally another process called the transverse processes, and at this junction it also gives a superior smooth surface called as superior articulating facet, so which will articulate with the inferior articulating facets of the above vertebrae, forming facet joints. Okay, and at the center, because of this arch at the center, it forms a vertebral foramen or vertebral canal, we can call it as vertebral canal. This canal transmits the passage of spinal cord with its meninges and its blood vessels. Okay, and this is the overview of the parts of the typical vertebrae. Now we will see one by one. The body lies anteriorly. The body lies anteriorly. It is nearly cylindrical in shape, and the size and shape varies in different regions of the vertebrae. And it possesses 6 surfaces. One is the upper surface, and the same below, lower surface, anterior surface, posterior surface, and 2 lateral surfaces. Totally it possesses 6 surfaces, and the upper and lower surfaces are rough and provide attachment to the intervertebral disc. So this upper surface and the lower surface are rough and provide attachment to the intervertebral disc. The anterior surface is convex anteriorly from side to side, and concave from above downwards, If you can see this thing, the vertebra on the lateral view, typical vertebra on the lateral view, so you will have some concavity from anterior to posterior. So this is the body. So here is the pedicle. Okay, so from side to side it is convex, from above downwards it is having some concavity. Okay, now on the anterior surface it also bears small openings for the passage of veins. So it bears small openings for the passage of veins. And coming to the posterior surface is flat above downwards, slightly concave from side to side, and it bears one or more large openings for the exit of basivertebral vein and number of small foramen for nutrient arteries. So it is having a large opening because of concavity. So here it is having it forms an opening for the exit of basivertebral vein and number of small foramens for the nutrient arteries. So these are the features possessed by the posterior surface of the body. Coming to the lateral surface, this will continuous with the anterior surface, and it is having the same features of anterior surface. So bodies of vertebrae lie one above the other or separated by the intervertebral disc and forms the central axis. Okay, this is about the body of typical vertebrae. And the pedicles, coming to the pedicles, so the vertebral arch. So the next one is the vertebral arch. The vertebral arch consists of pair of pedicles, a pair of laminae, and also we have seen so many processes. So totally we are having 7 processes. All these forms the arch. Now we will see one by one. So pedicles. So these pedicles are short. The pedicles are short and thick processes, passes backward from the junction of the lateral and posterior surfaces of the body. This pedicle will pass backward. Okay, so it is running backward. So these are short, thick processes, pass backward from the junction of posterolateral surfaces of the body, and it is possessing 2 surfaces and 4 borders. So what are the surfaces? So it is having medial surface. So here you can have medial surface and lateral surfaces, and medial forms the boundary for the vertebral foramen, and lateral one is free and rough. Lateral side is free and rough. Coming to the borders, so here the borders are anterior border, which is united with the body, posterior border united with the lamina, superior border is concave, and inferior border is also concave. Both helps in the formation of vertebral notch. So the superior concave forms superior vertebral notch, and inferior concavity of the pedicle forms the inferior vertebral notch. Okay, that notches we can see on the lateral view. Okay, so just see that it is having anterior border, posterior border. Anterior border fuse with the body, posterior border fuse with the laminae. Okay, and superior border it is having concavity forming superior vertebral notch. Inferior it is having another notch called as inferior vertebral notch. Okay, and the medial border forms the lateral boundary of the vertebral foramen, whereas the lateral border of the pedicle is free. Okay, now coming to the intervertebral foramen, already we know that this intervertebral foramen transmits spinal nerves and vessels and also spinal cord. So when two vertebrae articulate with each other, the inferior vertebral notch of the vertebrae above together with the superior vertebral notch of the vertebrae below form the intervertebral foramen. Intervertebral foramen. Through this intervertebral foramen will have the spinal nerve will come out. So we have seen that superior notch is formed, superior vertebral notch is formed here, and inferiorly you'll have inferior vertebral notch, isn't it? So just assume that another vertebrae is present on this, then that inferior vertebral notch is at the same level of superior vertebral notch. So you can see on the lateral side, you can see the pedicle here. Yes, so you can see the pedicle and another pedicle superior surface and the inferior superior surface is concavity forming a notch. So above that another vertebrae, this is disc here, that is having inferior notch. So this inferior notch and this superior notch forms a intervertebral foramen. Okay, this will sit over one over the other. Through this spinal nerve is coming out. Through this spinal nerve is coming out. So that one we can see on the lateral aspect, lateral view. But you should know that the pedicle has superior vertebral notch and inferior vertebral notch. The superior vertebral notch combines with the inferior vertebral notch of the another vertebrae forming a intervertebral foramen. That intervertebral foramen transmits spinal nerves and vessels, whereas the vertebral foramen transmits spinal cord and the spinal vessels here. So just see the difference. This is the vertebral foramen. Each vertebrae is possessing this foramen called vertebral foramen. But so with the help of two vertebrae, another foramen is formed on the lateral aspect, that is called intervertebral foramen. That intervertebral foramen is formed by the superior vertebral notch of the below vertebrae and inferior notch of the above vertebrae forms the intervertebral foramen. Okay. And the next one is now coming to the laminae. So how this laminae are formed? Broad plates of bone lying behind and medial to the pedicles. So medial side, this one. So this one forms the laminae. Okay, pedicle medial side. They fuse behind in the median plane. They fuse behind in the median plane into spinous processes. So into spinous processes. So here you can see again the medial side. So you can see the facets are somewhat laterally. So pedicles on the medial side, it runs posteromedially and then it forms the spinous processes Okay, so this is about the laminae. Okay, they form posterior boundary of the vertebral foramen. They form the posterior boundary of the vertebral foramen. And next, processes. How many processes are there? So already we have seen these two laminae fuse to form spinous processes. And these spinous processes are also having different shape and size in different regions of cervical, thoracic and lumbar region, and this spinous process gives attachment to muscles and ligaments. Okay, and coming to the transverse process, these transverse processes are two in number, one spinous process and two transverse processes. Totally how many? 3 processes. Okay, so they project laterally from the junction of pedicle and the lamina, and also in the thoracic region they will articulate with the ribs. So the transverse process articulate with the ribs in the thoracic region, but not in other regions. This is one of the peculiar features seen in the thoracic vertebrae. Okay, in the remaining vertebrae we can't see such kind of facets for the articulation. Okay, and coming to the other articular process, one is the superior articular processes, 2 superior articular processes and 2 inferior articular processes. So these articular processes are also facing differently in different regions. Okay, facing differently in different regions. Cervical region, the facets will face differently when compared to the thoracic region and when compared to the lumbar region. Because of the facet orientation, the type of movement is changed. The mobility is changed in different regions. We have seen that in the cervical and the lumbar regions will have more range of flexion and extension than rotation, whereas in the case of thoracic region it is having it is having less range of flexion and extension, and it is having more range of rotation, whereas the rotation is restricted in the lumbar and the cervical region because of the orientation of the articular processes. Okay, so this is about the parts of the typical vertebrae. So finally we can see again the entire parts. So anteriorly it is having body and posteriorly it is having arch. So this anterior part is called body and it is almost cylindrical in shape and it is having 6 surfaces: upper surface, lower surface, anterior surface, posterior surface, and 2 lateral surfaces. Upper surface and the lower surfaces are rough and articulating with the intervertebral discs. So, and posterior, the arch is formed by the pedicle, and this pedicle extend medially, posterior-medially, forming lamina, and which further extend posteriorly to form the spinous processes. And passing backward from the pedicle towards laterally, it forms another processes called the transverse processes. We'll have 2 transverse processes in the thoracic vertebrae. So the ribs articulates with the transverse processes. Such kind of articulations are not seen in other areas of vertebrae. Okay, this arch and the body forms a foramen at the center called vertebral foramen. Vertebral foramen. Okay, and here they have seen given foramen magnum. This is not correct. This is vertebral foramen. So foramen magnum is continued with the vertebral foramen. That is the meaning of here. And then also the pedicles is also having some notches: superior vertebral notch and inferior vertebral notch. These notches helps in the formation of intervertebral foramen. So these are the parts of the typical vertebrae, and in different regions, the cervical, whereas thoracic, lumbar, and the sacral regions, so there are some variations in these parts. So that variations we are going to see according to regions. So now we are concerned with the thoracic region. So we are very much worried about the thoracic vertebrae. So in the next video we are going to see the thoracic vertebrae, typical thoracic vertebrae, and also atypical thoracic vertebrae in the next videos. Thank you.